Okay. So, hi everyone. Thanks for being here. I know that have been tough days. So my first question is, how are you? I hope that you're doing okay. My name is Rebecca Calzada. I work in Youth Rise. I'm from Mexico, based in Mexico. I also do their harm reduction activities and drug checking. And we're very happy to have this space to discuss a very important issue, that is drug education with that base in harm reduction. So I'm very excited to be here with our panelists that are very incredible, and I think they have a lot to say today. And there's not enough time, unfortunately, but we will try to keep on time. So I'm program manager at Youth Rise. Youth Rise is a youth-led organization where we advocate for the health, rights and well-being and the inclusion of young people in drug policy discussions and also in harm reduction discussions. And we try to ensure that the voices of young people are here in this type of discussions. For us, it is very important to try to bring the voices of many people from our regions that cannot be here, unfortunately. But today I have the pleasure of moderating today's discussions, where we will be exploring how harm reduction education can become a key tool in protecting young people's health and rights, and not only providing accurate information, but empowering young people to make informed, safer decisions in a world where they encounter drugs in their reality in different aspects. So before we start, I would like to thank a lot our sponsors, co-sponsors, the government of Brazil, the Czech Republic, the European Union, and Switzerland for endorsing this very important discussion. I would also like to express our gratitude to the UN Office of the High Commissioner for Human Rights, UNDP, the WHO, UNAIDS, UNICEF, and all the incredible civil society organizations that have supported this event. My most sincere thank you to all the panelists that have accepted our invitation to share their experience today. We have in person 3 panelists, but also online we have other 3 panelists. So this session basically is grounded in the growing global consensus that drug policies and education must center the voices of young people and affected communities. The 2023 report of the UN High Commissioner for Human Rights highlighted the valuable role of civil society, people who use drugs, and youth in shaping drug policies that reflect real-world experiences. That we think that's the most important thing to include in drug education curriculums. And additionally, the recent 2024 report of the Special Rapporteur on the right to health calls for the full implementation of harm reduction policies, including comprehensive education and public awareness campaigns. Despite these clear international recommendations, drug education in many countries remains abstinence-based, completely disconnected from reality, and delivered through a criminalization lens. This approach not only excludes young people, but fails to equip them with the knowledge and tools they need to stay safe, whether they choose to use drugs or not. So the research behind today's session was conducted by one of our international working group members, Andre Belchor Gomez, and provides a very much needed youth-centered perspective. It revealed how current drug education, often focused on a criminal and danger approach, misses the mark. By the time these young people receive formal lessons, many have already encountered drugs, formed their own perception, distrust distrusted educational institutions, and in some cases experience punitive policing firsthand. What they ask for, what this group of people that were part of this research ask for, is for a gradual, repeated, and practical education that helps them understand how drugs work, how to navigate situations where drugs are present, whether they use drugs or not, how to respond to peer emergencies, and how to stay safe and reduce harm. They call for a culturally sensitive approaches that recognizes their diverse backgrounds and life experiences, rather than imposing a one-size-fits-all narrative. This research aligns closely with the themes we will explore today, as we hear from a panel of global experts and practitioners who will present practical examples of youth-centered harm reduction-based education programs from different parts of the world. Over here you can see a QR code on the screen, and this will link you directly to the report. And I invite you to scan it and to download the report, and if possible to read it. So I would like to invite our first speaker today, who will provide us with some opening remarks. And before we start, I'm going to be this terrible person that will tell you when your time is over. So Mrs. Natalia Dutra, I hope I pronounce it correctly, is the coordinator for alternative development in drug policies at the National Secretariat for Drug Policies and Asset Management of the Ministry of Justice and Public Security. Her work focuses on integrating alternative development strategies with harm reduction and prevention approaches to promote social inclusion and mitigate the socio-environmental impacts of drug policies. So, Mrs. Dutra, the floor is yours. You have 3 minutes.
Thank you so much, Becca. Thank you for being here after such a busy week. We really appreciate it. It's an honor to be here with you to discuss a topic that is not just about policy, it's about dignity, rights, and sustainable livelihoods. I'd like to begin expressing my gratitude to Rebecca Rocha for the invite, and all the as well as the OHCHR, UNDP, and UNODC agencies, and all the co-sponsors of this event. Your commitment to advancing harm reduction policies rooted in human rights principles is not only commendable, but essential. And today we gather to reaffirm our shared mission, ensuring that young people are equipped with evidence-based harm reduction education, allowing them to make informed choices about their health and well-being. In this sense, I'd like to stress that the guidelines for human rights and drug policy provides us and have inspired us in Brazil with a fundamental framework for achieving this goal. These guidelines remind us that harm reduction is not just a best practice, it's a human right. In Brazil, the need for this shift in drug policy has never been more urgent. Our country serves as a stark example of how punitive drug policies deepen structural inequalities. The war on drugs in our country has disproportionately targeted Black and peripheral communities, pushing young people into cycles of violence, incarceration, and social exclusion. The statistics are horrible. Criminal organizations actively recruit children and adolescents, exploiting economic vulnerability and filling the gaps left by inadequate access to education, employment, and social services. It is also impacting sorry, I'm so tired. In areas heavily impacted by drug-related violence, young people are 3 times more likely to drop out of school by the age of 16. In Rio de Janeiro's Favela da Maré, schools lost 43 days of education in 1 year alone due to police operations. In 2022, 76% of those killed in police interventions were between the ages of 14 and 29, 83% of them being Afro descendants. And among youth who have gone through the juvenile justice system, studies indicate that 50% of them will most likely fall victim to homicide. And in some regions, this rises to 73%. Okay, I'm really running out of time, and I had prepared a longer speech, so I'll skip to the closing remarks. But in Brazil, we're implementing a program called Planassi Youth. Planassi Youth is a national initiative to tackle this, aimed at breaking the cycles of violence and exclusion among at-risk young people. It also integrates harm reduction strategies aligned with international human rights standards, access to education, and economic opportunities. Right now, we have over 4,000 beneficiaries in the cities of Rio de Janeiro, Salvador, Recife, and Brasilia, with expansion plans to reach 50,000 youth, including indigenous communities in the Brazilian Amazon. And I do think that it's important to highlight the fact that this program is built on the basis of public participation. So every time Planassi Youth reaches a municipality, the first thing we do is hear out the demands of the youth, so that this is very much a tailored approach that we have. And with this, well, I had prepared a nicer speech, I'm so sorry, but to respect the time, I'll leave it at that, and I will welcome any questions that may arise regarding this program. And we do believe that we're at a pivotal moment, politically wise, globally wise, a moment that demands unwavering commitment to human rights, to racial justice, to sustainable development. In this sense, I would like to very much encourage all of us present here to truly protect young lives, the fact that we must expand harm reduction, education, and services in schools and communities, shifting from punishment to health-centered responses and involving civil society, affected communities, and youth is at the very heart of the Brazilian national drug policy right now, and I do hope that other countries follow suit on this. That's all. Thank you.
Many thanks, Mrs. Dutra, and I'm really sorry for being this person. Now I would like to invite our following speaker, Professor Joan Sete.
I answer to anything.
Chere is one of the faculty of the Columbia University School of Public Health in New York. She was the founding director of the HIV program at Human Rights Watch and the executive director of the HIV Legal Network in Toronto. She was also the deputy director of the Global Drug Policy Program of the Open Society Foundations and the main author of the 2006 report of the Lancet Commission on Drug Policy and Public Health. Professor Joan will share some reflections on current approaches to school-based drug education, examining the policy implications for students' futures and rights. The floor is yours.
Thanks, and happy to see you all here. In the United States, about 1 million people have died of overdose since 2010, and many more had suffered non-fatal overdoses. It's appalling, but perhaps not surprising, that many of these overdoses occurred among young people. I say not surprising because in a country where everyone should know how to prevent and confront overdose, young people in the U.S., with few exceptions, are grossly underinformed in this area. And that's partly because school-based drug education programs, supported by hundreds of millions of taxpayer dollars, have largely lacked harm reduction information of any kind. The U.S. has, in addition, exported its school drug curricula to many countries. The dominant programs before the children in the U.S. and these partner countries mainly strive to help young people say no to drugs for life, emphasizing the danger of taking drugs even once or for a short time. Some young people will embrace the say no for life message, and that's of course great. But to base a drug education policy on the idea that all young people can be taught to be drug-free for life is neither respectful of young people's rights nor grounded in the behavioral science that we have. Let's think about the difference between drug education centered on the Say No for Life message theme and one that's centered on a theme like be as safe as possible and help your friends to be as safe as possible if they choose to use drugs. Which of those do we think will help us more with harms like overdose, hepatitis, HIV? Which of those is more consistent with the public health-based approach that so many countries espouse in meetings like this CND? A central tenet of the right to health is the right to scientifically sound and accessible information about health. For young people, that means, to use the words of the Convention on the Rights of the Child, respecting their evolving capacity to understand reality-based information. It's not respectful of their capacity to tell young people that taking drugs, even for a short time, will ruin their lives when they see around them people that take drugs, maybe even adults who carry on in spite of their drug use. There's a body now of a respectable body of peer-reviewed research that shows that drug prevention education fails when educational messages are out of step with young people's lived reality and allow them no room to question the disconnect that's there. In the US, programs designed to scare kids about drugs and get them to keep saying no have not generally been effective at preventing drug use, according to many evaluations. But they have been effective in many cases at cementing the idea that the answer to drug use is policing and more policing. And they've effectively promoted the idea that drug use is a matter of personal irresponsibility and poor moral character. The complex causal factors related to the initiation and sustenance of drug use among young people or adults are often not even considered. That means also that stigma against people who use drugs is thus reinforced. So abstinence-only drug education further is likely to make it difficult for young people to speak openly about their drug use experiences or ideas. Young people are keenly interested in harm reduction and indeed may have developed their own ideas and practices to achieve it. Programs that allow them to talk about those ideas hold the promise of improving existing practices and thus promoting safety. There's a need as well for schools to be a safe space in legal terms for being able to speak about drugs. In the US, many states support what we call the school to prison pipeline. That is, as a matter of policy, schools report to the police any minor drug offenses that they may find among students. In these schools, it almost doesn't matter what's in the drug curriculum because the harm of cementing moral judgments and over-criminalization will already be done. So we hope that in hearing about the real-life experiences of places where we've gone beyond the Say No Forever message, that we will be inspired to be creative and very rights-centered as we think more about how to respect young people in talking about drugs. Thanks.
Thank you so much.
I timed mine, by the way.
Yeah. Very precise. Thank you so much, and I think it's very, very important what Joan just mentioned, that it's very linked to Andres' research, that one of the main findings was about how reality drug education is from the realities of young people. And one of the things I think that is very important to mention is that they don't even they don't have this type of tools when it comes for emergencies such as an overdose, or to even identify an overdose and know what to do. So now I'll pass it to Damon Barrett. He's a co-director of the International Center on Human Rights and Drug Policy and senior lecturer in human rights at the University of Gothenburg, Sweden. And
thank you very much. So, I'm going off script, so you're going to have to use that thing on me. But just when we sat in here, I remembered that when Youth Rise was founded, I was still, by one definition of youth, still a young person. I was 29, so that's gone. I'm really glad that we're talking about harm reduction in education because it focuses attention on younger young people. There's a big difference between being legally a child and being legally an adult when it comes to this stuff we're talking about. So if we look at the Convention on the Rights of the Child, it requires appropriate measures to protect children from drugs, including appropriate educational measures. So the question we have to ask then is, what does an appropriate educational measure look like? And the Convention on the Rights of the Child can't really dictate that, except it can provide guidance with the other articles and the other principles, like Joanne mentioned, in terms of evolving capacities. I think key to that is recognizing the child's right to be heard in accordance with their age and their maturity. And I think harm reduction for this age group is going to look different than for adults. And if we're honest, I'm not sure the harm reduction field has been very good at dealing with that so far. And so if I had my way, this would be in the plenary room and everyone would be required to go. So I've recently been researching the experiences of people who began injecting drugs before they turned 18 in 3 countries. One of them is Sweden, where about a third of people who inject drugs began before they were 18, which we can all admit is a core harm reduction focus, harm reduction issue. So I want to tell you about Vera, which is not her real name. Vera is a young Swedish woman who began injecting amphetamines when she was 15 with a small group of friends, and she contracted hepatitis C very quickly from the older person that introduced the group to injecting. All of them contracted hepatitis. But as a teenager, she lacked control over her own injecting practices, where she was getting equipment, where the drugs were coming from, who was injecting after who, and she lacked knowledge. She lacked anywhere to find trustworthy knowledge at her age. And here's what she said. She said, people thought maybe you could boil it away, but you couldn't. Nobody talked to such people, young people, about stuff like this. Her hepatitis diagnosis was shared with the school, and the school didn't know what to do. So she was made to use a bathroom on her own and made to, quote, feel dirty, as she put it, which is the essence of stigma. Harm reduction in school, then, in an appropriate educational setting, I think is not just about what's said, but how young people who use drugs are treated. So Vera was placed in compulsory drug treatment, and following that treatment, she made sure never to let anyone know about the extent of her drug use again, because she said she was, quote, scared to death of going back there. There can be, I think, a dual silencing of quite young people when it comes to drug use. First, because they're immature, and second, because they're using drugs. So it's like a dual silencing there that needs to be dealt with. Here's what Vera said when she turned 18 and got an adult social worker for the first time. This is Vera speaking now. Then she said, what do you want? What? There had never been anyone that asked me what I wanted. The only thing I needed was an adult that listened to me and respected me. So meeting people where they are, or Americans say where they're at, I think that's unnecessary.
We don't always say that.
That's the essence of harm reduction, and that's exactly what Vera got when she had an adult social worker. But let me tell you that none of our participants experienced that when they were children. But some reported a transformation when they first encountered harm reduction, an ability to open up finally. So what does it mean to meet people, children and young people, where they are when it comes to drug use? I think, as Joanne said, I think schools need to be a safe space for talking about drugs, but what we find instead is fear of discovery. We find fear of discovery by schools and therefore social services, and we find the threat of school exclusion as well. The opposite of that is trust. So I think a focus has to be on creating an ethos of trust in schools, where the right to be heard can actually be exercised. Thank you.
Thank you so much. Perfectly on time. Thank you so much. And what you just mentioned is very important, because we usually hear these policy discourses where they say, let's empower youth. And sometimes we forget that empowering youth is bringing actual information that is helpful based on the realities and allow them to make safer choices. So up next, I'm very happy to introduce Professor Nina Rose Fisher. Professor Nina has vast experience designing, implementing, and evaluating youth-centered drug education curricula, and will be sharing some insights with us today. So Nina, if you could hear us, the floor's
I can.
yours.
Can you hear me?
Yes.
Yay! Hello, everybody. I'm so happy to be here, and thank you for that fantastic setup. And what Damon and Joanne were saying really feeds perfectly into this presentation about safety first. I evaluated a harm reduction curriculum that is based in the principles that we've been discussing that are so important. And not only is it critical to take youth where they're at in terms of providing drug education and support, and counseling and advocacy, it's very important to include youth in the research and evaluation of drug education so that we can ensure that what the youth are experiencing, what's being measured, is what youth want to know and what youth want to see happen in drug education. So I conducted a participatory action research with young people that helped design the mixed methods survey tool and come up with the focus group questions and interview questions pre and post what's called Safety First, which is an approach that was developed by the Drug Policy Alliance in the U.S. and has now been replicated internationally. And it is, again, based in harm reduction principles, taking young people where they're at and really learning about substances specifically and understanding how to advocate for harm reduction-based substance use policy and interventions. And I think folks have said this already. You talked about this in Brazil and very similar in the U.S. And I found in my study of over 800 young people that the prevalence is there. Over 800 freshmen, 14-year-olds, 25% of the young people were using substances daily, 50% were using substances weekly, 75% monthly, and only 25% had maybe used not at all or maybe once or twice. So the focus is really important of the curriculum to look for it to be harm reduction based, to have a focus on media literacy so young people know how to understand the influences, right, of media from a micro to macro and how that influences. To using non-judgmental, non-stigma-filled language, teaching concrete actions to reduce harm reduction. The curriculum includes what is a drug, right? How drugs work, different types of substances, mental health related to substance use, disproportionality in terms of how folks are affected based on neighborhood, race, class, gender in the U.S. because of our current political climate. It really is going to be dependent on a more federalist understanding on state by state, city by city, town by town to decide how drug education is implemented. So it's really important to have tools like Safety First, which is an accessible curricula for free that folks can now access online. It's now through the REACH, the Stanford University REACH School. So really understanding how to support young people in creating a healthy future for themselves and how to advocate for harm reduction-based policies. So an example from Safety First is young people learning about cannabis through different statements and finding out if they agree or disagree or unsure and figuring out what is the reality of cannabis and how do we advocate for harm reduction-based cannabis policy. As we know, cannabis has now been decriminalized or legalized across the U.S. and many states, so this is more and more important. Understanding, and folks, you talked about this in Brazil and other places as well, but really learning, young people learning how to take care of each other around substance use. So the recovery position as it relates to alcohol toxicity, understanding how to administer naloxone in an overdose. So young people actually got training, naloxone training from experts and learned how to stop an overdose. Drug checking. So the goals of the evaluation were really to assess the efficacy of Safety First in terms of attitudes, knowledge base, and behavior to see if there was any change related to these three domains and harm reduction. So there's a mixed, I conducted and developed a mixed methods study. This is the survey. I can send you this information because I know it's a lot. And what we found is there was significant change from pre to post in terms of the harm reduction attitude, behaviors, techniques, knowledge base. And it influenced a further expansion from New York City. There was a pilot study, and I expanded it and extrapolated the study to San Francisco and the five biggest public high schools in San Francisco. And showed that there had been a significant change in knowledge, behavior, pre to post Safety First. The techniques, including how to detect and respond to opioid overdoses, increased significantly. Knowledge of substances, school drug policy, how to advocate for harm reduction policies, and then young people actually engaging in developing harm reduction policy at their own schools and advocating for it changed significantly, increased significantly pre to post. Learning about the students loved learning about the recovery position, loved being able to debate and interact with information about substance use. They loved learning exactly what a drug was, how to define it, why people use substances, why teens use substances. Some significant findings were changes in the students' knowledge and understanding of substances like alcohol, that if somebody drinks too much alcohol, vomits, and passes out, that they should let them sleep it off. Students were more likely to disagree that marijuana edibles take immediate effect, so learning very specific information that actually gives young people agency over their substance use and over their decision-making overall. So there was significant behavioral change. Students reported less use. So one of the goals of Safety First was not to reduce use, but a collateral effect from my research showed that actually the harm reduction intervention did significantly reduce use. They reported less use of cigarettes, marijuana, prescription drugs after Safety First. 100% of the students were able to describe very specific harm reduction strategies, and they were able to understand a significant relation. Are we on time? Sorry.
Yeah, no, you just broke a little bit, but now we have you back.
Oh, good. Okay, I don't know where you lost me. So the young people...
Yes, please go ahead.
I learned about media literacy and advocacy, health impact of substances, harm reduction interventions, like responding effectively to an overdose, set and setting and how that relates to harm reduction, and dose and dosage and how that relates to harm reduction. They also understood the intersection of race, class, and gender with how drug policies are implemented in different areas and why, and how to advocate for just and fair harm reduction substance use policy. And that was demonstrated through policy campaigns that young people led stemming from the Safety First intervention. And what I did find is that school placement, meaning what school they attended, what teacher they had the most influence over their responses pre to post Safety First. Thus, the pedagogy, the organization of the class, the modality that the class is taught in has the most effect. So meaning that coaching and training and support of teachers who are implementing harm reduction interventions in schools is critical. Or if you're working in a nonprofit or grassroots organization or NGOs, folks that are implementing harm reduction interventions and educational curricula need to be supported and coached in how they are how they're teaching. And young people were very responsive when the pedagogy was done in a dynamic and interactive way, so that it was experiential. They loved the experiments that they got to. There was a Kool-Aid test where they got to test what was in a drug. They loved anything that was experiential, and they got to do their own exploration of what is a substance, of different substance use policies, and of how to advocate for policies. They really enjoyed any time that they were interacting with the information. So some of the outcomes based on the qualitative data, and this speaks to what Joanna was saying about how ineffective, we know how ineffective the Say No to Drug policies have been and education has been. One of the young people said it was not one of those DARE abstinence-only curriculums where they try to convince you that weed is a gateway to heroin and you will die if you try Molly. I actually felt like I learned something that wasn't fear-based. You seem to have tried really hard to make this curriculum great, and it shows. So I wish Vera had the Safety First curriculum, because there would have been a lot more validation around the experiences that Vera was having in Sweden. I learned a lot, and I didn't feel like I was just being told that drugs were awful and trying them makes you an awful person. I learned how to be safe and smart. So again, speaks to that wonderful case study that Damon shared. And then learning specifically about substances, about vaping. I like learning about the different effects on your brain and body. It was interesting to learn about the substances and what they do. The teachers explained it very well. I love the different activities, the scenarios. What did teachers say? Students felt safe to have open conversations. We were able to have honest, non-punitive discussions. My previous students were jealous. My students were unafraid to ask questions. It opened a dialogue and allowed us to have non-judgmental conversations.
Nina, can you hear us?
Yes. Yes, is it done? I'm sorry.
Yeah. We tried to text you, but to do it nicely.
So sorry. So the future goals of the research are to continue replicating the study of safety first to see how it works with different populations, and to get feedback from students and teachers about how to make it more effective, and to continue, make sure it's dynamic, right? That's really important, that any curricula that we implement is responsive to what's happening in the moment. As we know, drug policies are changing rapidly across the globe. So how can we make sure that our curricula is in response to what students are experiencing on the ground?
Thank you so much, Nina. I'm sorry that we don't have more time. And I think that you mentioned something very important about the relationship among students with professors, that it should be relationship of co-creation for problem solving rather than just imposing information. Now, I would like to invite our next speaker, Susana Ronconi. Is a qualitative researcher and a trainer in the fields of drugs, prisons, and social marginalization with a specific gender and human rights approach. Since early 90s, she has been working in harm reduction interventions, promoting and coordinating some of the first harm reduction outreach programs in Italy. In 2000 and 2008, she was a member of the National Interministerial Committee for Harm Reduction Guidelines. She's one of the founders of ITAR, Italian Harm Reduction Network, and the president of the scientific board of Forum Droghe, Italian NGO, working for drug policies reform and harm reduction.
Very long presentation. Okay, thank you. Thank you, Rebecca, and thank you, Youth Rise, for this panel on a very important topic. Something about the project I want to talk you on. It's a project dealing the promotion of a harm reduction approach in drug education at school. And the name in Italian is conoscere prima, that means knowing before using. And this is a sort of Italian translation of just say no. Okay. And it's a project that is inspired by the safety first approach. So I don't want to say anything about this because it's the same approach described in the previous intervention. And this perhaps works? Yeah. Great. And the project started 1 year ago, and we worked with teachers, with the school director, harm reduction educators, peers, and students. And we have some focus group with all these actors and the stakeholders. And then we dedicated one of our summer school. Every year, Forum Droghe organizes summer school for professionals. And in 2023, we organized a summer school putting together harm reduction professionals and teachers, just to work with them and to try to create a connection. And then we have just finished a manual and organizing the webinar to support teachers who want to adopt this particular model. But I don't want to talk about the project, but about what are the results from some focus group we organized with students before starting with the project. We make a focus group in the 4 different Italian cities with people of an average age of 16. And it is, first of all, it's interesting because this guy told us that school is at the bottom of the ranking with regard to their knowledge on drugs. Before comes peers, before comes the web, before comes some material distributed by the harm reduction professional, and before come families. Everyone before school. So this was very interesting for us. And we asked them what they think about drug use in general. And they say it's a common social experience. Drugs are not all the same, so this is interesting too. It's important to learn before using. This guy said, personally, I am in favor of using them only after having fully understood what drugs do. I study before using them. And they say the criminalization and the illegal markets, in their opinion, are the major risk for them. And say also that it is possible and it is necessary to use in a controlled way. This guy said it must be used in a controlled manner, not when you need to pay attention. So they are aware that there is a time to use and a moment to use, and this is very interesting in a controlled use perspective. With regard to drug education at school, there is a merciless judgment, because they said, first of all, there is a lack of structured paths. In Italy, there is very episodic, there is not structured program of drug education at school. Then they think that there is a posture of that it is uninformative and full of prejudice. They stress that often there is a scare approach with a big exaggeration of risk, nothing about benefits, and they say they listen often to falsehoods, so false information. One said, it wasn't a confrontation, we were all a little terrified. So to feel a little terrified is not the best feeling in an educational context, I think. There is stigmatization of use and a lack of open and secular debate. And this is interesting in my opinion. There is minimal or no recognition of the skill of those students who use. One said, they said a lot of wrong things, not exact, but I didn't feel like saying my piece because I would have marked badly, and I didn't want to show that I am someone who knows these things. So I stress this because there is a false division between students who use and students who don't use. And the students who use had not the opportunity to say anything about their experience and to exchange their experience. I want to close reminding Roger Skagard that we had the opportunity to meet many years ago in Rome. We organized a wonderful seminar with him. And he was used to say, they, young people, deserve respect. So the conclusion is that when we organize drug education at school, we have to respect their right to secular knowledge, their personal experience and skill, their right to participate in an active way to drug education. We have to respect their intelligence and ability to orient themselves. And we have also to respect, in case, their fragility and offer them help and not judgment. Thank you.
Thank you so much, Susana. Some colleagues from Peru, they have a saying, I'll say it in English and then in Spanish and then translating, and their main saying is que la información llegue antes que las drogas. So information should arrive before drugs. And I think you mentioned something very interesting about sometimes how we forget that young people have agency, they want to stay safe, and they care about their communities too. So up next, I would like to invite our following speaker, also colleague and member of Youth Rise, Isaac Olushola, who has a robust professional and academic background in public health, along with extensive experience in drug policy reform, advocacy, and contextual harm reduction in Africa. He's currently finalizing his master's degree in global health science and Epidemiology at the University of Oxford in the United Kingdom. Isaac, can you hear us?
Yes. Setting up my slide for you to see.
Perfect.
Can you hear me?
Yes.
Okay.
Yes, we can hear you.
All right. Thank you. Can you see my slide?
Yes.
Okay.
Yes.
All right. So, hi everyone. My name is Isaac, and then I work with UTRIs, and then basically I'll be talking about this project by Student for Sensible Drug Policy. We led this project in Nigeria and across about 7 other African countries. And then, I'll dive straight into what we really did during this project. But it is basically in 2 contexts. The problem with just saying no to drugs, and then our solution of say no to drugs. And then I want us to picture this in this way. Imagine you are a young person stepping into the university for the first time. You are full of dreams, excitement, and let's be honest, a little bit of curiosity. And now, before you got to the university, your parents had warned you, if you ever touch drugs, you will go mad. And that sounds dramatic, right? And then, well, that was one of the experience of one of the students that passed through this peer education program. And what happened to him? You may be curious. So he got to school, and then he met the smartest guy in his class, the one topping all the exams, who surprisingly smokes marijuana at night class. And so what did this student do? What did he do? He did calmly sit to research the safe use of drug or the potential harms or the legal risk. Of course not. He jumped straight into using drugs, completely unprepared, and it hit him hard. And that is the problem. Just say no didn't prepare him. It made him more curious. And that is what led to this solution of the peer education program, which we see as a vaccine against misinformation on drugs. And we launched this program in Nigeria for a starter, and then we started it at the University of Calabar in Nigeria with about 20 teams. And over time, we were able to spread across 20 federal universities in Nigeria, and then we move across different countries as well in the African setting. And the simple but radical ideas that guided this project are basic information. And these are young people don't need fear, they need facts, and then they don't need judgment, they need knowledge. And if they are going to make choices, they should be able to make them safely. And these are the guiding principles that led to the design of this peer education program. So we trained peer educators to go into schools and talk to students about drugs, and not to scare them, but to educate them. They learn about the potential harms, what is overdose, harm reduction, and how they can support their friends in crisis. And you may ask, why this approach? And here's the thing, when you only tell young people drugs are bad, don't do them, out of context, you leave them more vulnerable. And some will try it anyway, often without the right information. They go ahead and try it, just like the scenario I shared earlier. And but when we treat education like a vaccine, we build immunity against misinformation, and then we are able to protect young people from this risky behavior. And I would like to ask us, would you let someone drive a car without teaching them how to use the seatbelt? No. Would you fight diseases without vaccines? Maybe no. And then, so why fight drug-related harms without knowledge? And that is one of the guiding principles we used in our peer education program. And one of the peer educators once told us that he used to believe that anyone who smokes weed is a failure until he met a professor who is well published and is a cannabis user. So we are able to give young people, students, the right information about drugs, the potential harm, the benefits, and how they can use it safely if they want to. And if we don't provide this accurate and non-judgmental education, young people will learn, and they are going to learn the hard way through their experience. And often this experience comes with serious consequences. So through Just Say No education program, we are changing the narrative, we are engaging young people with evidence-based knowledge, we are preventing harm instead of punishing curiosity. And also we are training peer educators to be the first line of support in schools and communities. And then to wrap things up, the world is changing. Young people are getting access to different information on social media, on TikTok, WhatsApp, and some of this information may not be accurate. And so we believe drug education, having such curriculum in schools, is giving us an opportunity to prevent a pandemic that may happen in terms of drug use. And so harm reduction is becoming mainstream as well. And it is time we treat drug education like we treat any other public health issue, with facts and not fear. So next time when someone tells you to just say no to drug, I think you should tell them to, get the knowledge, say no. Thank you.
Thank you so much, Isaac. And well, finally, it's my pleasure to invite our last panelist. Also, she's part of Youth Rise. Her name is Carolina Humada. She's a sociologist from the University of Buenos Aires. She's the Advocacy Executive Assistant at Intercambios, Civil Association in Argentina, and Youth Engagement Program Lead at the International Youth-Led Organization, Youth Rise. So, Carolina, the floor is yours.
Thank you so much, Rebe. One sec, I just want to share my screen, which is basically the most important thing here, that are basically the teenagers that we work with in No Te Sientas Zarpado. So, one sec. Wait, I'm gonna do that again.
We could see it before.
Yeah. But I wanted to put the here. Sure. Okay, I can't do that right now. I would leave that for later, so you can see them after I finish with the presentation. So hello everyone. I wish I could be there with you in person, but here I am. Hello to my fellow Youth Rise team members, and it is a pleasure to be here. I am going to speak about No Te Sientas Zarpado, which the translation in English would be like don't feel overwhelmed. So thank you so much for the opportunity. So in the logic of the war on drugs, demand control operates through fear and risk as prevention tools and abstinence as the only treatment. In schools, this translates into expulsion, pathologization, punishment, and stigma for adolescents. At Intercambios, we promote a logic of support rather than punishment, considering prevention and care as strategies for peer education and empowerment. Through awareness activities, peer promoters, support spaces, listening centers, and adult mentors, we seek to create environments of care and support for teens. The No Te Sientas Zarpado program was a harm reduction and comprehensive health approach for adolescents in socially vulnerable contexts. After 12 years of work, No Te Sientas Zarpado, Let's Talk About Drugs, the harm reduction program for adolescents and young people implemented by Intercambios, together with Fundación Armstrong, La Salle School, is closing its cycle in González Catán, La Matanza district. No Te Sientas Zarpado was created to accompany the life paths of adolescents and young people in Greater Buenos Aires addressing issues related to drug use. From this starting point, the program deployed a wide range of comprehensive health actions through an interdisciplinary, intersectoral, intergenerational, and intersectional approach. Over the years, it has implemented more than 100 health promotion campaigns covering topics such as violence reduction, sexual and reproductive health, harm reduction, and prevention of drug use. The program impact between 2012 and 2023, I am going to say a couple of numbers. So, No Te Sientas Zarpado carried out 300 drug use prevention workshops benefiting 8,000 adolescents, 950 individual counseling sessions at the listening centers or centros de escucha, 7 training programs for teams with 150 adolescents participants, 250 community-based health promotion actions reaching 170,000 adolescents and young people, 100 prevention campaigns, 140 radio programs, 300 adolescent-focused health promotion messages on drug use, violence, sexual and non-reproductive health, and mental health, and 400 training and support activities for adults, educators, community leaders, and caregivers, benefiting 12,100 people. During this time, the NTSZ team actively participated in the González-Catán Territorial Roundtable, received the Presidential Award for Solidarity Schools, had young representatives in the National Advisory Council on Adolescent and Youth Health, published articles, and presented their experiences at various events, like today, for example. Many of these actions were made possible thanks to national and international funding, including support from the Dutch Embassy, UNODC, the National Secretariat for Drug Policies, and also the Ministry of Culture of Argentina. If you ask if we are receiving that type of funding right now, the answer is, unfortunately, no, especially from Argentina. The structure and organization of the program was composed of an adult technical team, a team of adolescent promoters made up of high school students and members of local organizations with periodic rotations, and also a listening center, which is a centro de escucha, providing guidance and referrals where necessary.
Carolina,
I am going to speak up.
Sorry,
yes.
Sorry to interrupt you, but you have to close because we're almost on time.
Okay, fantastic. I am almost done. So basically the main action lines of the program are the social skills and values promotion, which is basically prevention workshops in schools and organizations, the first contact guidance and orientation, peer promoters, educators, which is training adolescents as peer educators, community communication, the production of radio programs, content, and also a documentary about the project, and of course, strengthening adult mentors, training and supporting teachers, families, and other educational actors. And to wrap up, you might, yes, basically, why no te sientas zarpado, or why don't feel overwhelmed. So basically, we say that against feeling zarpados or overwhelmed by the challenges of substance use, No Te Sientas Zarpado created a space for listening, guidance, and support. Against feeling zarpados or stigmatized by the adult world in neighborhoods, schools, institutions, or even at home, No Te Sientas Zarpado became a meeting point free from moral judgment, punishment, or exclusion. And last but not least, beyond what was expected, we zarpar or push boundaries, creating new social, emotional connection and alternative paths for existence, allowing both adults and adolescents to reinvent themselves change direction, and venture into new possibilities over and over again. And yes, right now I would like to finish the presentation with the adolescents, which are basically the heart of this program. You can see them there. A couple of pictures of the radio and also for the activities. And yes, hello kids, you're at the UN. So yes, thank you so much, and it was a pleasure to be here with all of you. Thank you so much.
Thank you so much. Before we close this session, I hope that we have more time. I'll pass the floor to Silvia from the UN Office of the High Commissioner of Human Rights.
Thank you very much. I've been asked to deliver closing remarks for this wonderful event on behalf of the Office of the High Commissioner for Human Rights, one of the co-sponsors of this event. Big thanks to the co-organizers, to Youth Rights, and the numerous co-sponsors which span over 7 lines on the concept notes and the pamphlet of your flyer for organizing this event. We won't name them all. The title of this event, I wish they had told us how to be safe, captures the sentiment of many young people who have been failed by current approaches on drug policy, disconnected from their lived realities. OHCHR's 2023 report, as was mentioned earlier, on addressing human rights challenges in tackling the world drug problem, articulated that punitive drug policies have failed young people, have caused significant harm to individuals. And the report emphasized that the importance of engaging civil society organizations and young people in the design and implementation of programs should be including young people, the very people that are affected by those policies. As highlighted also further by UN treaty bodies, human rights treaty bodies, and as was mentioned earlier, the Committee on the Rights of the Child did express growing concern with the detrimental effect of drug abuse on adolescent health, recommending that states address the incidence of drug use by children and adolescents by providing children and adolescents with accurate and objective information, as well as life skills education on preventing substance abuse, and developing youth-friendly drug dependence treatment and harm reduction services. Here, we'd like to bring forward, it was raised earlier, the international guidelines on human rights and drug policy, which further reinforce this approach, which were co-developed and supported by our office and a number of other UN agencies, including the International Center on Human Rights and Drug Policy at Essex University, call for the removal of age restrictions on access to harm reduction to ensure that young people have access to drug-related health information and counseling based on their evolving capacity and best interests. And here we'd like to raise the 2023 Human Rights Council resolution, which actually authorized our OHCHR office to issue the recommendations that I just mentioned in our report on addressing human rights challenging in the world drug problem. That Human Rights Council resolution recognized the urgent need for states to take steps to ensure health-related information, evidence-based prevention, specifically adapted to the needs of young people. We believe that shifting away from punitive policies toward human rights-based approaches is essential for addressing drug-related challenges facing our youth today, and that harm reduction education represents a pragmatic approach and strategy that empowers young people to make informed choices about their own health and about their own well-being. We commit to supporting initiatives that promote age-appropriate harm reduction education and have repeatedly called on member states to provide for such services in their drug policy strategies. We're prepared to continue to work collaboratively across sectors to engage young people as active participants rather than passive recipients in developing educational approaches that actually resonate with their lived experiences and needs. Thank you very much on behalf of the Office of the High Commissioner for Human Rights, and big thanks to Youth Rights for bringing a number of panelists across a number of continents here, both virtually and in person. Thank you very much.
Well, thank you, Rebecca, Teresa, all my team, and of course the incredible panelists. I think we were very ambitious. We needed like 2 hours to discuss this very important topic, and I apologize that I cannot open the floor for other questions, but please, if you want to get to know more about this, here you have the panelists. And in Youth Rise, we have many resources. Also, we just launched the report on full spectrum harm reduction, where we discuss about harm reduction from an intersectional perspective. So please go there, look around. There are colors, but also many resources. Very interesting. Thank you so much.